Everybody high. In the era of evidence-based medicine, clinical practice guidelines have become omnipresent. They serve as essential frameworks for standardizing care and improving population health outcomes. However, for the practicing physician, a tension often exists between the standardized recommendation on the page and the complex patient in the exam room. While guidelines are indispensable tools, they are not commandment. The physician's role is not merely to enforce compliance but to synthesize the best available evidence with clinical expertise and the patient's unique reality. The map, not the territory. The individual principles of guideline application is that these documents are intended to inform, not replace clinical judgment. Guidelines are useful but not prescriptive. They function best as a baseline, a starting point for clinical reasoning rather than a rigid destination. Physicians must identify the red flags of checkbox care. Rigid adherence to algorithm can lead to the neglect of multimorbidity or the disregard of a patient-specific context. True patient-centered care requires the flexibility to recognize when a guideline does not fit the person's comorbidities, preferences, or values. Critical appraisal, the clinician's duty. Trust in guidelines must be tempered with critical appraisal. Guideline development is not always a perfectly clean process. It can be influenced by financial, methodological, and publication biases. Consequently, not all recommendations are created equal. To mitigate this, clinicians should favor guidelines that are multidisciplinary and transparent. When reviewing new recommendations, physicians should look for a clear disclosure of conflicts of interest, transparent methodological processes, graded evidence quality, and consistency across different specialty societies. From guidelines to practice, the workflow. The clinician's responsibility is to operationalize these recommendations through the lens of individual risk, benefit, and feasibility. The implementation of a guideline begins with a conversation. Physicians should explain the options, uncertainties, and trade-offs inherent in the recommendations. By aligning the care plan with what matters most the patient, the physician ensures that the intervention is not just clinically sound but personally viable. Start with the recommendation, then tailor it. Does the patient's renal function contraindicate the first-line agent? Does the recommended screening schedule align with the patient's life expectancy and goals of care? Individualization is the hallmark of expert practice. When judgment leads a physician to deviate from a guideline, documentation is paramount. The medical record should reflect the specific reasoning behind the divergence, nothing the relevant evidence, the specific patient context, such as side effects or comorbidities, and the outcome of the shared decision-making process. And conclusion. Medicine is an iterative practice, constructive dialogue, including questions, comments, and the sharing of clinical experiences, helps refine how guidelines are interpreted and applied in the real world. By treating guidelines as informative baselines rather than restrictive mandates, physicians can ensure that their practice remains grounded in evidence while being deeply responsive to the individual patient. Thanks for like and sharing.